Joined this morning by Dr. Paul Slater, who's a senior lecturer in the statistics from the School of Nursing and Paramedic Science at Ulster University. So over to you now, Paul.
Good morning, everyone. Hopefully you can hear me. And as Stephanie says, I'm a senior lecturer in statistics, and my role within the university means that I sort of transcend across a lot of different areas concerning healthcare and social care research. But I do have experience in conducting research in palliative care and have a number of publications in that area as well. Today's talk is really just to give you an introductory taster to quantitative research and quantitative research methods, methodologies, and to have a quick look to see how it interacts with palliative care, and also finishing off with future developments in relation to quantitative research and the use of quantitative research in palliative care. So I'm just going to assume that you have a rather rudimentary understanding of what is quantitative research, but try and build on that and trying to explore a couple of the issues. So over the course of the talk, I'll be looking at the definitions and assumptions underpinning quantitative research, looking at research designs and methodologies, touching upon statistical analysis and hopefully alleviating any fears that you may have in relation to quantitative research and statistics. There tends to be a bit of a fear factor with putting people off engaging in quantitative research because of their fear of mathematics or the fear of engaging in statistical analysis. And I just want to address that and alleviate that at this point in order to promote quantitative research. And then also just touching upon some of the ethical considerations through the challenges and considerations when engaging in quantitative research, particularly in the area of quantitative research. So if we go back right to the very fundamentals of quantitative research and look at its ontology and epistemology, we see that quantitative research is very much based in the field of positivism. And that's has the ontological underpinning of reality as a single reality, that it exists external to ourselves, and that as researchers we can have an objective, unbiased position in relation to that reality. The generation of knowledge or epistemology underpinning it very much manifests that belief pattern, that notion that we can define the world around us, and as a consequence of that definition, we can also construct measurement of it. At its very core, quantitative research is anything that can be converted to numeric values and measured in that manner. That could be observations, or it could be attitudes or beliefs or anything associated. But as long as it's convertible to a numeric value, then it qualifies as being quantitative research. And that's the key characteristic of quantitative research, is that notion of numeric value. And with that numeric value, we can take it from its most simple descriptive frequencies or tallies of incidents occurring, and we can manifest it right up to the more complicated, complex statistical methods, such as meta-analysis, confirmatory factor analysis, structural equation modeling, latent growth analysis, the likes of that. It's really up to you to determine where you want to take it to. So the assumptions underpinning quantitative research and the key characteristics of quantitative research in comparison to, say, qualitative research is that with quantitative research, much of the heavy lifting is done before you collect a single piece of data. In quantitative research, we are very much directed by theories and a priori knowledge base. We construct, we identify our variables, we construct our conceptual models, we define those variables, and we create hypotheses in relation to the variables, relationships of one variable to another variable. As a consequence of that, we can identify measurement tools that allow us to measure the variables that we're interested in. And with that measurement and that creation of hypothesis, we can test if our assumptions are true in relation to the relationship between a particular variable and another variable. And I'll explain this and bring it to life a little bit more as we go through the talk. Research designs, there are only about 5 or 6 key research designs that you need to be aware of. These fall into 2 categories of experimental and non-experimental, and an understanding of both of these is a fundamental prerequisite when engaging in quantitative research, because it underpins a lot of what is done. Methods-wise, we have a number of different methods, but the key characteristic, as I already have highlighted, is that as long as the information can be converted into a numerical format, then it qualifies as quantitative research. The most common measurement types are surveys or tools, collecting information around various different variables and domains that we are interested in. And we have socio-demographic characteristics as well that we can collect along the way. We also have statistical analysis, and when we're engaging in statistical analysis, if we know our research designs and we know some fundamental elements of our measurement types or our methods, then the statistical analysis flows very quickly after that. And within palliative care, ethics becomes a significant issue. We are dealing with a particularly nuanced area of work where subject matters can be quite sensitive. So we need to be aware of that and incorporate that within our quantitative research designs. The nature of having this objective positioning of the researcher when conducting quantitative research means that we're detached from what is conducted within the research. So we have to pay particular heed to the ethical requirements and the ethical demands and bring them into our research designs when conducting quantitative research. Now, as I said, at its most basic level, quantitative research works on the premise that we have a theoretical model or a conceptual model underpinning our research design. So that's our starting point. And we have that design before we collect any data, unlike qualitative research, where we end up with a theory after we've conducted our analysis and collected our data. Within quantitative research, we start off with our conceptual model, the model that we have underpinning our research study. And from that, we can construct everything that we need to know about the research that we want to undertake. So if we look at this model here, this simple conceptual model, we're looking at, we're interested in exploring satisfaction with care. So this may be with a palliative care population, and we want to look at geographical differences, two locations, location A and location B. And we want to see, is there any difference in satisfaction with care across the two locations? So that's the formation of our conceptual model. From this conceptual model, we are able to identify what we mean by satisfaction with care. So we can define it. We can say, what is satisfaction with care? How will we characterize it? And we can provide an active definition of that as well. And with that active definition, we can also go ahead and identify a measurement tool to collect information in relation to satisfaction with care. So we can go and get an off-the-shelf survey that looks at care satisfaction. And that forms our measurement tool there. Alongside that, we can look at the two locations and we can identify them, identify inclusion criteria, exclusion criteria for both settings, and incorporate that into our survey as well, looking at satisfaction with care. So from a simple conceptual model underpinning our research, we can identify what we want to measure, where we want to measure it, who we want to measure it with. We have a clear definition of what we're measuring, and we can also identify a measurement tool to measure what we want to measure. And this is before we've collected any data whatsoever. This is all in the conceptual stage. So as I said, the key characteristic of quantitative research is that it's front-loaded. A lot of the heavy lifting is done before we collect one piece of data. We've identified what our independent variables are and our dependent variables are. So satisfaction with care would be our dependent variable, and the two locations are independent variable. And based on this, we can make assumptions or hypotheses to test to say that is there a difference between the two locations? So we can create relational arrows linking our locations to our measurement. And with that, we create hypotheses or research questions. So a hypothesis would be that there is no, or a null hypothesis would be that there is no differences between the two locations in relation to satisfaction and care. So from a very simple conceptual model, we can identify what we want to measure, our dependent variable. We can identify where we're going to measure it, our independent variable. We can identify and define what we're looking at and identify the measurement tool corresponding to it, and supplement it with additional information that relates to our inclusion and exclusion criteria. So before any data is collected whatsoever, we've constructed a skeleton version of a research proposal. And we can identify research questions that we want to test once we collect the data. A good quantitative researcher can start to populate a results section before they collect any data, because they already know what they're going to look at and they know how they're going to present the evidence once they get the evidence. So all of the heavy lifting. All of the work is done before you collect one piece of data, and you have everything set out so that you can collect the information in an unbiased, objective manner. And that's links back to that fundamental assumption of a single reality and how we construct our knowledge, or the notion of epistemology from that. And we can make this as complicated as we want. And here's an example of a study that was undertaken in relation to palliative care and attitudes towards palliative care. And you can see here, this is structural equational modeling that I got from a study that I looked at. And it's looking at attitudes to palliative care and the relationship between knowledge, beliefs, and self-efficacy, and the impact of self-efficacy on knowledge and beliefs, the relationship between knowledge and beliefs, and how these go on to impact on attitudes. So like I said, quantitative research can be as simple as a tally system of frequencies, leading up to more complex statistical models, such as the one highlighted here. Within quantitative research, we have a number of different research designs that we can select. The selection of research designs generally falls from or builds upon quantitative research. Some researchers have particular schools that they feel more comfortable within, quantitative research and qualitative research. I straddle both schools as such. I see a role for each and a place depending on the research question that you're trying to investigate. A lot of quantitative research builds on the work, the good work undertaken in qualitative research. And within quantitative research, there's a hierarchy and an evolutionary process involved in it. If you think of research and you're investigating any specific topic area, we go through a process of collecting information around it, say using qualitative techniques, understanding the lived experience of a particular event. And from that, then we can see some commonality emerging from the qualitative research or across different qualitative research designs. And we can identify what are the key characteristics within that. And once we start to identify those key characteristics or those shared characteristics within the qualitative research, we can coalesce that together and start to formulate our own notion of a basic conceptual model. And we can start to define the variables that we're interested in. And then we can start to create measurement tools or instruments to measure those elements. And once we start to do that, we can engage in descriptive studies to get a broad overview of what it's like out there. Now, there may not be complicated research methods or conceptual frameworks at this point in time, but this is all the collection of evidence, this evolutionary process in quantitative research development. When we get more confident in it and we get more information emerging, we can start looking at cross-sectional surveys and engaging in case control or cohort studies. And these are all broadly termed as descriptive research designs. They don't examine causality, their correlation in nature, but they still provide us with a strong body of evidence that we can draw on, and to move forward that evolutionary process in the collection of evidence. And once we have enough evidence collected together, we can move across into the experimental side and we can start to manipulate variables. This evolutionary process has to occur, or randomized controlled trials at the most basic level, randomized controlled trial would cost around about £1 million. So you're not going to get that funding without having a body of evidence underpinning and justify why a funding body should provide you with that money in order to conduct your RCT. So we have to collect that information, we have to provide it, and the movement from descriptive into cross-sectional and maybe into cohort provides that information and allows us to move across into randomized controlled trials. Where we don't have randomization, we have a quasi-experimental research design. It's a little less, it compromises causality, but it still provides us with a good body of evidence that we can look at. The gold standard within all research is the RCT, or the double-blind RCT. It provides us with the strongest possible evidence there is. But the movement across from the descriptive or the observational into the experimental shows that progression, that evolutionary process. And from that, we create a hierarchy of evidence. We go from expert opinion, background information, very much informed by qualitative research, case reports, and then we start to move up through the observational descriptive research designs and into the experimental research designs. And whenever we have enough information and enough replications of interventions using RCTs, we can start to pull that information together in the form of systematic reviews of the evidence, and then start to create a meta-analysis of the findings from our RCTs, or indeed now into many of these other research designs, in order to provide an even stronger, larger data set that we can draw causality from. And it is here in this area here that we see many of our guidelines emerging. NICE guidelines, Cochrane Review guidelines, and the likes. So we can see there's an evolutionary process involved in quantitative research that takes us through. So we've moved from that simple design, that simple conceptual framework. We can apply that simple conceptual framework and everything underpinning it around variable identification, definition, measurement, and then control and manipulation to a point where we have an extremely strong evidence base. So there's a constant evolutionary process to the work that we engage with within quantitative research. Now, what's this all got to do with qualitative or with palliative care? Well, if we examine the evidence in relation, or the research studies that have been undertaken in relation to palliative care, we do see a significant number of clinical trials being conducted within it. I've been involved in ones that have looked at things like testing interventions in relation to the management of constipation, and clinical trials to look at the effectiveness of educational programs in relation to that. Survey research. Within palliative care research, there was an initial focus on being very qualitatively orientated because of the subject matter that was being examined. We wanted to understand the lived experience of palliative care and everything associated with that. In recent times, we have seen a movement backwards from that to look at it from a wider angle. I've been involved in studies where we've looked at survey research, where we've looked at attitudes to palliative care across Northern Ireland. And we've replicated that on 2 occasions. We looked at knowledge using the PACS, the palliative care knowledge too. So we can engage in those wider population-based examinations using survey methods as well. There's epidemiological data and big data sets merging within that too. We've seen with the movement towards digitization within healthcare environments, there's been more and more digital data produced. We need more and more expertise in relation to quantitative research in order to collect or to ensure the quality of that data and to properly scrutinize that, to explore different pathways and relationships between the data as we go through it. Quantitative research methodologies provide a huge opportunity in relation to big data and registry-based studies. And we also have moved across into having better definitions and the generation and testing of measurement tools to look at definitions of variables under interest. I was involved in a study recently where we looked at advanced care planning and trying to understand and develop a tool in relation to the measurement of that. So we could look at both using survey methodologies, examine population beliefs in relation to SEP. And we can create a definition and a measurement instrument that allows us to do that with surety. A fundamental principle of research is that without reliability and validity in a measurement tool, all information is useless. So we need to ensure that we have good psychometric properties of the instruments that we use within quantitative research. And this applies to palliative care as well as all other aspects of healthcare research. That's how we're using the assumptions underpinning quantitative research. This notion of our ontology of a single reality, or epistemology, the rules and regulations that we set in place to create knowledge in relation to that single reality, our movement into quantitative research and the notion that a single reality is measurable, definable and measurable, and that conceptual model of defining a variable that we're interested in, and from that definition creating a measurement tool, and then creating a hypothesis to test in relation to that. That's before we collect any data. We can apply our rigorous research designs alongside that. We have our standardized data collection tools. From that, we can create data management protocols. As I said earlier, a good quantitative researcher can construct a research or a results section before they collect any data. The reason why we can do it is because we know what we want to look at. We have our hypothesis there, or research questions there that we want to test, and we can set out our procedures or our protocol on how we're going to manage that data, to look at it, to ensure that it's as best a quality that we can possibly get in order to answer our research questions effectively. And we can construct our results section based on that. When we collect the data, we can then populate that with the actual numerical values. And we can test those research questions. And all of this is done beforehand. All of this is done before we collect data. Once we collect the data, we engage in statistical assurance procedures or quality assurance procedures. That's the management of data to ensure that it's the best of quality as we can possibly get. Quality assurance is particularly required when we are looking at big data sets. Those registry data or data such as those derived from digital healthcare records. Within that quality assurance, we check to make sure that that the information is of decent quality to allow us to draw proper inferences from the information we collect. And once we have done all of these procedures and we've provided all of these assurances, we can then engage in our statistical analysis. I've taught statistics for the best part of 11, 12 years now. And I've taught them to different levels of experience within quantitative research. And whenever I'm speaking with health professionals, many of them tell me that they don't like quantitative research because they hated mathematics. We've moved on significantly from having to conduct or having to do the statistical analysis by hand. So there is no real necessity to have an in-depth understanding of mathematics in order to engage in statistical analysis. Statistical packages like SPSS or JASP have drop-down menus that you simply can select the information that you want or the statistical test that you want and populate it with your dependent and independent variables, and it'll do the statistical outputs for you. It'll do all of the heavy lifting that's required. So there's no real necessity to understand or have a deep understanding of statistical procedures and techniques. Leave that up to the geeks. You simply need to know the research designs and the measurement types and what you're looking to examine in order to be able to select the right statistical test, populate the statistical package that contains that test, and then just interpret the results accordingly. Many useful books, such as SPSS for psychologists, or Discovering SPSS by Andy Fields and Alex, are excellent books to assist you and take you through step-by-step procedures to interpret the statistical outputs that come from it. What to pay attention to, what to ignore, and how to write it up. So there's no real reason or fear of statistics or reason for having a fear of statistics holding you back from engaging in quantitative research. So we can move beyond that now. And within a particular challenge within quantitative research, when we're engaging in research looking at palliative care issues, is this notion of ethical or regulatory compliance. We have to ensure, given the subject area that we're looking at and the participants that we're looking to recruit in many cases, particularly if they're patients or the general public, we need to pay particular cognizance to the ethical and regulatory requirements of engaging in quantitative research. Given that objective nature that we have when we're collecting the information, we don't have the luxury of qualitative research where we can gauge views and opinions and distress levels when we engage in quantitative research. We step back from that. That's a core principle within quantitative research, that objectivity. So we have to have the appropriate checks and balances at an ethical level incorporated within that process. And we need to be cognizant of that too. And as a consequence of that, what we see is our research designs being adopted. So if we're engaging in an RCT, we can adopt it to have a more pragmatic approach to set it within the work environment that we're going to be, or the environment that we're going to collect the information in. So ethics within palliative care research using quantitative techniques becomes a particular issue that we need to be aware of. But it shouldn't stop us from engaging in it. And the challenges underpinning quantitative research and other considerations, this is quite repetitive of what I've already said, that notion of ethical sensitivity. We have recruitment and retention issues given the population that we're collecting information from. We need to be aware of that. We need to have, with that awareness, we need to incorporate that within our research design to ensure that we can get the best quality information possible and do it in as rigorous a manner as possible. As I said, within statistical knowledge, we've moved away from this notion of conducting the analysis by hand. We haven't done that in 30 years. Statistical knowledge now really comes down to understanding the research design and the measurement type, and being able to define what our dependent and independent variables are, and the rest is simply drop-down menus. So we shouldn't be scared by that, and we shouldn't let it interfere or stop us from engaging in quantitative research. There's interdisciplinary collaboration, that notion that we should be moving beyond single silos to incorporate interdisciplinary teams and their views and opinions, and how that impacts on our measurement too, on what we measure. And within quantitative research now, we very seldom engage in a single methodology anymore. Within RCTs, very few will be funded, and they're very hard to conduct without funding, unless maybe within a PhD. But very few will be done as a single entity. They'll always involve some integration of qualitative research methodologies as well. Quantitative research will give you information on the effectiveness of an intervention. It'll give you a measurement type, or a measurement of how more effective is this particular intervention than, say, treatment as usual or no treatment at all. The qualitative information that goes alongside that, interviews, focus groups, or the likes, will tell you how it worked. Quantitative will tell you that it worked. Qualitative will tell you how it worked. So we see more integration of qualitative research methodologies over the last number of years. Quantitative research in palliative care, its applications have informed many areas such as policy development. Quantitative evidence is very strong and can help inform health policy decisions and resource allocations. We can predict trends, we can predict using data from previous years and population growth, we can predict into the future. And with that prediction, we can make health policy decisions and the appropriate allocation resources as a consequence of those predictions. We can also look at clinical decision-making, develop up guidelines and protocols through the systematic review of evidence that we've collected using quantitative techniques, and provide stronger evidence in relation to what works and what doesn't work, or what works more effectively. It will also help us to quality improve through the identification of inefficiencies and that measurement of interventions. And as we move into digital assistance and new digital technologies, we can evaluate their effectiveness or their cost effectiveness. So we're seeing now an increase in the movement to using quantitative techniques to inform decision-making at a policy and a practice level within palliative care. In recent times, we've seen quantitative research being utilised more and more within the area of evidence synthesis. This includes meta-analysis and systematic reviews, as well as collecting of information from our observational descriptive research designs, such as cohort or case control across cross-sectional surveys. And we're also seeing, in particular, this core outcome measures. As we engage in more and more research in order to inform and feed into meta-analysis and systematic reviews, there has been a movement within healthcare research to a position where we're saying, okay, let's standardize what we are measuring across different interventions. Let's standardize our core outcome measures so that we can look and compare across different countries, different studies, different populations. And we're seeing a growth in that over the recent times. And we're moving towards a position where we identify those core outcome measures that will inform all quantitative research designs as well. That's a quick whistle stop tour to quantitative research and its application within palliative care. This is a bit self-indulgent, but there's a number of papers both myself and Dr. Felicity Hassan have developed in relation to quantitative research designs that will support a lot of the information that we provided here, or I've provided here, that you can read. They're only 4 or 5 pages long and very, very informative. Thank you, and I'll take any questions now.